Hello, and welcome to our show today. I'm Tracy Tubbs, Cancer Control Specialist with the Kentucky Cancer Program. The Kentucky Cancer Program serves every corner of the Commonwealth with information and services to reduce the impact of cancer. Created by legislation enacted in 1982, KCP was established to reduce cancer incidence and mortality through education, research, and service. The program is administered jointly by the University of Louisville James Graham Brown Cancer Center and the University of Kentucky Lucille Parker Markey Cancer Center. KCP has 13 offices across the state staffed by cancer control specialists who coordinate cancer prevention and early detection programs, patient and family services, professional education and training, and who mobilize communities through coalitions and partnerships to address local cancer problems. KCP is recognized nationally as a unique program that is state-funded, university-affiliated, and community-based. The partnership with Kentucky's two major academic institutions, U of L and UK, and University Cancer Centers enables KCP activities to be based on science, driven by the latest and most accurate cancer data, and to serve as a laboratory for population-based research. KCP operates through a network of 13 regional offices staffed by trained and experienced cancer control specialists who provide local leadership on cancer prevention and control initiatives for all of Kentucky's 120 counties. KCP works closely with the Kentucky Cancer Registry and 15 district cancer councils across the state to identify and develop interventions to address cancer problems. KCP provides a range of cancer programs to health professionals, the public, patients, and families. Dedicated to education, research, and screenings, KCP establishes partnerships with the American Cancer Society, Kentucky Department for Public Health, the Kentucky Cancer Registry, the National Cancer Institute's Cancer Information Service, Susan G. Komen for the Cure, Lung Cancer Alliance, and other national and state and local organizations. KCP is an important partner in the Kentucky Cancer Consortium, the state's leading cancer organization, and helped draft the initial cancer action plan that led to the formation. KCP plays a major role in linking Kentuckians with cancer resources through personal contact at our offices, community health fairs, and events. KCP also provides the Pathfinder, an online tool that enables users to research by county for cancer-related resources and screening and tobacco information and referral, patient assistance, medical care, survivorship, and support groups, and national and state resources. KCP maintains district cancer councils in each of the 15 area development districts to offer vital support for strategic planning to address local cancer problems and to implement statewide initiatives in every region. Representatives serving on the councils are from county and district health departments, hospitals, government agencies, healthcare providers, universities, businesses, labor unions, schools, tobacco coalitions, and others. Cancer survivors are also represented. Working in collaboration with these partners, KCP leverages resources to mobilize communities. Every 2 years, KCP reports to the Commonwealth on its statewide efforts. Today, I'm joined by Jamie Smith, another cancer control specialist with the Kentucky Cancer Program, to discuss this in more detail and to highlight more of our regional programs right here in our community. Jamie, thanks for joining us today.
Thanks for having me.
Please tell the viewers how long you've been with KCP and what exactly we do as a cancer control specialist.
Sure. I've been with Kentucky Cancer Program for a little bit over 9 years, and in this position as a cancer control specialist, we focus a lot, obviously, on the community and what we can do to help not only just the general community on prevention and early detection, but also cancer patients and professionals. And we do that through a multitude of different programs.
Okay, good. And one major focus on KCP is cancer prevention and early detection. Can you tell us how our local office of KCP focuses on this topic?
Sure, there are a lot of programs that we do offer. First of all, we have one program called Cancer-Free Families. And so just by the name of that, you know that it's obviously going to focus on early detection and prevention. And we can go in and offer these programs in a multitude of different facets. We can do it in work sites, we can do it for community groups, we can do it for just about anybody that wants to listen to
kids
us.
too.
Absolutely.
Yeah.
And this particular program really focuses on prevention and screenings that are available. There's only a few cancers that we have preventive screenings for. And so one of our major focuses is making sure that the community knows when they need to talk to their doctor about those appropriate screenings. And so this program really goes over in detail about all those screenings, and then we focus a lot on prevention. And so that's healthy lifestyle, it's tobacco cessation, it's protecting our skin even in the summertime and in the winter from the sun. And so this program just really covers all of that.
Right. And you had mentioned smoking cessation. We have a plan to be tobacco-free. Can you elaborate on that?
Sure. One of the newest programs that we have is Plan to be Tobacco-Free. And what we've noticed is that sometimes when we go to our physician, we don't always have enough time to really talk to them, to dive deep into how one can truly be successful in creating a quit plan for tobacco use. And so we've talked to the medical community, and we came up with this program, and it's a 1-hour session that we offer in different atmospheres for patients. And so we can do that in community facilities. We can also do those in work sites. We can do those in churches. We can also do those on one-on-one coaching calls, or just one-on-one in person with patients. And so what this program really does is starts with the general addiction process, explains that to the patient, and then we walk them through the process of creating a quit plan. We go over all the resources that are available to help them. We go over all of the nicotine replacement products that are FDA approved, and there's 7 different products that we can go over with the patients and let them know how to correctly use those to give them the best chance at a quit. And we have proof that it shows that if someone does use those medications, they double their chances of a successful quit rate. And then we really focus on triggers and barriers that someone might encounter. And so it's a lot of individualized time with that. And then they can go back to their doctor if they need a prescription for one of those medications, but they leave with a plan in hand.
And a lot of times, I know you've probably experienced this too, when you're one-on-one, it's almost like they're venting and they're, talking about, why am I smoking? Why can't I quit? And if somebody doesn't want to do that 1-hour session, is there like a quit line that they can call?
Sure. We partner with the state health department, and they have a national contract with National Jewish Hospital out in Colorado for the 1-800-QUIT-NOW. And so if someone were out there today that wanted to do that, they could call 1-800-QUIT-NOW, and they would be linked with a professional health coach on tobacco cessation, and they would do much of the same, and they can get up to 4 or 5 calls with a coach that will really help them in each of those aspects that we cover in that program as well. And then they have special initiatives for special populations. They do have some that use spit tobacco. There's a special line for them. They've got pregnancy postpartum. So if there's a pregnant woman out there that's been a tobacco user, but she wants to quit smoking while she's pregnant for that baby, and hopefully she would continue that after the pregnancy as well for the baby. But they would actually pay them to enroll in that program as well for pregnancy postpartum. And so they get a coaching call, and those are 10 sessions that pregnant women can receive. And so they have them for younger people as well. So just really anyone can call, and even a family member that wants to learn more about how they can help their loved one can also call and get information as well.
That's awesome. Now also, I know the Quit Line has just started helping with nicotine replacement therapy.
Yes, so the nicotine replacement therapy is available through the Quit Line, and they offer that to people without insurance throughout the year. So it just kind of depends on what part of the year you're in. You can get it from anywhere from 2 to 8 weeks.
Wow.
So I just always encourage people to call the Quit Line and see what program they're running at that specific time, because like I said, it changes so much throughout the years. And but you can get at least 2 weeks at all times, but they do have specials sometimes where they run it for 8 weeks.
That's really good. That'll help for sure.
Sure.
Now at KCP, I know we love our Pathfinder. Can you tell the audience what the Pathfinder is and what actually it entails?
Sure. So for probably about 26 years, we had a paper Pathfinder where we would have to continuously update, and we printed those and tried to disseminate those into areas in the community where people could get those. And so times have changed, and everything's really gone digital. So about 1.5 years ago, we launched a digital on our website. You go on there, you'll see the Pathfinder logo. You click on it, and then it takes you to a new web page where you would be able to click on different categories, like you mentioned in the opening. They've got screening and prevention, they've got medical care, they have support groups, they have patient assistance. There's a multitude of different categories that they can look at, subcategories under that, and then it'll bring up a state map. and they can click on their county that they live in, and it's going to bring up all the local resources, not only from their county, but the surrounding counties in that particular ad district. And then right below that, it's going to list all the state and national resources as well. So it's a one-click, and they get all of those. They can print the screen and have that in their hand too, or they can just look at it on the screen.
So that's a great resource to have, especially if you're a caretaker of someone in your family that has cancer. If you're, having problems getting, gas in your car or, bills paid, they can find that on the Pathfinder.
Anything like that. And if they have problems with it, feel free to call our office, and you can personally navigate them through that website as well. And we really want to serve as a navigation tool for patients and families as they're going through that process, because it can be an overwhelming experience when someone is diagnosed with cancer. And so we really feel that this is a tool that can help alleviate some of that frustration and confusion and just overwhelmingness that someone may experience. And it will relieve some of those financial burdens that some people have as well with some of those resources.
And it's updated pretty frequently. So
yes, the nice thing with digital is that you can do that in real time. And so it's always updated. And we really focus on it twice a year to make sure everything's updated. But the nice thing is with a community like we have, we know of changes that happen, and those changes can be immediate online.
And if somebody also has something to add to that Pathfinder, they can call us. And
absolutely. They should call you, and you can definitely give them the form to fill out to get that resource approved and online.
Okay. Well, we've already talked about the Pathfinder, but how does KCP help cancer patients and families other than the Pathfinder?
Sure. We do a lot of different things, a lot of fun events as well. One thing that we do offer is support groups, and we have some here locally as well. One in particular that we have is a breast cancer support group that our office is really involved in, and they can call our office to find out more information about that. But there's other organizations too in the community that provide some support groups, but we have those listed on our Pathfinder as well that they can find. And there's a lot of state and national resources as well that sometimes just do phone call buddy systems, and you can find those as well. So there's something out there for everyone if they just need that additional emotional support.
Right. And especially for kids too. We have things for kids. We
have kids summer camps, and a lot of people don't know that. So if you have a child that's been diagnosed with cancer, we do have summer camps here in Kentucky that they can go to. They also have sometimes sibling camps. So sometimes it'll just be a camp just for siblings of someone else that has had cancer, because those siblings are dealing with a lot too. And so they can connect with other children that have had siblings with cancer, and they can share some of those same emotions. And then there's some that are for families. So they have weekends that are sometimes specified just for families, and it would be the whole family that would go, the parents and the kids, be able to go to that. We also have what we call adventure weekends for women. And those are right now tied with the state parks. So we go around to different state parks in Kentucky, and we'll have a weekend, usually from a Friday to a Sunday, where women of any cancer are encouraged to attend. And there's a small fee for that, but if a woman can't afford it, we do have some scholarships that are available for the weekend. But those are offered once a year. And so for any woman out there that's interested in that, feel free to call the office, talk to you, or they can go online as well and find that on our Pathfinder, and they'll find information about that.
Sure, and we have one coming up actually in September.
Yeah, and we offer those again at different times during the year. So, whether they're spring or fall, but that's usually in the spring or fall is when those are held each year. So, and again, it's a different state park. The one thing that's neat about the state parks in Kentucky is that each state park has a special activity. And so at each of those state parks, we're able to highlight that with the women that weekend. And so it's some things that women have never done, such as archery, skeet shooting, horseback riding.
It's going to be fun.
Yeah, some of those things you just never do, but it's really time to explore the state parks, and we have a beautiful state.
We do. And we also do survivor celebrations and education. Let everybody know some of the good things that KCP offers.
Sure. We've done some really special initiatives before in the past. We've done a Faces of Cancer project. We did that for several years, where we highlighted one survivor from each county in our area, and we did some survivor celebrations with that. We did one regionally, then we did them in the counties as well. We've partnered with the hospitals locally before too to do a National Cancer Celebration Day, which National Cancer Survivors Day falls in June. It's the first Sunday in June of every year. And so there's always some type of celebration that goes on with that. And so a lot of times those survivor celebrations are tied to that. And then, there's other organizations in the community that have different times of the year where they celebrate survivors, and we help promote those. and get the word out. And then we obviously are happy to partner with different organizations on those too. So every month of the year is a different cancer. And so I always encourage people to find out what each month is. And if you look around, there's probably something special that's going on, and anyone can be involved in that. It doesn't have to be someone that's just diagnosed with that cancer, but sometimes they have them even for family members that, maybe have lost a loved one and they want to come and, celebrate the life of their loved one. And so those are special opportunities throughout the year.
Absolutely. Now we've talked about the cancer patients themselves, we've talked about their families. Let's talk about some things that we do for professionals in our area.
Sure, we focus a lot on professionals, and so we have one category of KCP that's totally dedicated to professional education. And so we do this in numerous different aspects. Of course, as a cancer control specialist, we're constantly taking new information into providers to make sure they know the latest and greatest. And one of those happens to do with screenings.
Absolutely.
So for Kentucky, we're very, very, very special and very humbled that we have some programs that offer free screenings to Kentuckians for different cancers. One in particular is the Kentucky Women's Cancer Screening Program, and that is a breast and cervical cancer screening program. And so women that do not have insurance or low income can go to the health departments, and then they can receive some of the services there at the health department, or there's contract providers in our local community that women can go to get these. So for cervical, they're going to get a pap smear. They're also going to get a exam, and then they're going to get, for breast cancer, they're going to get a clinical breast exam, and then they're also going to receive a mammogram during those. And so if someone is going through that program and then they find something precancerous or cancerous, the great thing with that is that then that woman can pick up Kentucky Medicaid for treatment for that. And so we don't want any woman out there to feel like they don't have an option, because they do. The other unique program for Kentucky is the Kentucky Colon Cancer Screening Program. And so right now they can go to the health department as well for that, and they can get FIT kit testing, which is a take-home test for colon cancer. And they would send that back into a lab. And what they do is they try to detect blood in a stool sample on that. And then if they were to find something suspicious with that, then that patient would go back in for a colonoscopy. And we do offer those here locally as well. And we have partners in the community that are offering those. And the good thing with the Kentucky Colon Cancer Screening Program, those tests are free for patients.
Yes, I love the fact that we can send them to the health department. They can get a kit for free, do it in the comfort of their own home and not have to worry about anything. So.
And then also for professionals, we do some specific education with them as well. We have several programs where we can offer free continuing education for providers. All of them have to get a certain amount of continuing education, which as a patient, I'm happy that they're always updated on the latest, but we offer some free programs for that. One of the things we're doing right now is we're really focusing on a new screening that's available, and it's available in our community. It's called a low-dose CT screening for lung cancer. And so there's several facilities in our community that are offering that, and we're going around and taking a toolkit to providers to let them know about that and how they can appropriately find patients in their practice that qualify for that program, and then how to make a referral into one of those screening programs for the patients.
Okay, that's a great program also called LEADS. That's the grant that we're on right now. So we've talked about the professionals. Now let's talk about our community partners in the Purchase area.
Sure, we partner with just so many different organizations, and that's the uniqueness to Kentucky Cancer Program. We're on the community level and we focus strictly on communities, but one of the best ways to do that is to have multiple partners at the table, because every organization brings a different aspect to the table. And so some of those that we may work with, you mentioned some of the opening is the American Cancer Society, local hospitals, and once I'll demonstrate one example with that with the hospitals and some of the providers is that we offer a free skin cancer screening every year in this community, and it's held in Paducah. It's always partnered with Blue Earth Hospital and Baptist Health Paducah, and then our local dermatologists jump in on that as well, and it's free. And so it's always on a Saturday, half a day, and people can come to that and get a free screening. If they have something that they're worried about, they can come get it looked at, and those providers let them know if they need to worry about it or not, and then that patient can follow up with the dermatologist here locally to get that taken care of. So it offers a great peace of mind for several. And then it's a great opportunity for us to do community education at that point in time too, to really stress the importance of how to protect our skin.
Right.
And we live in an area where we're blessed by beautiful lakes and lots of outdoor activities, and not only in the summer, but in the winter too.
Yeah.
And really, we've got to protect our skin year round. A lot of people don't think about that,
Right.
but sunscreen's important year round.
Farmers, lots of farmers
Yes.
in this area.
And you've got a lot of workers that just work outside every day. Utility companies, road workers. I mean, there's construction. There's just a ton of jobs that put people outside every day.
Right.
And so we can do some education with that as well.
Right.
But we partner also with schools and universities. The extension offices are another partners of our prevention center.
We've done a lot with churches, actually.
Yeah, senior centers. Just the faith-based organizations, those are one of the ones that we really love to focus on, because whenever you start something in a faith-based organization, a lot of times those are extended families that are in there. You know, you're a part of a huge group, and so everyone loves each other in there,
Right.
and it's a great opportunity to go in and to be able to educate and to do specific targeted
Right.
actions in there.
Yeah, we do have a lot of fun there.
Yes.
If someone wants to volunteer their time for KCP, I know we have a lot going on and we love volunteers. So tell them how they can reach us and how they can volunteer if they would like to do that.
Sure. We have several opportunities here locally too, and we have specific events that we do locally every year that people can volunteer for. For example, that skin cancer screening we have every
Right.
year. We can always take volunteers to help with that. We have different events that come up just periodically.
Our large colon that we take across the state.
Yes, every March we really focus on colon cancer, and there's several activities we do during March where we can use volunteers just to help spread the word. Obviously, October is another busy month with breast cancer. There's activities during that month that we have, but there's always an opportunity where if you're really passionate about cancer and you want to be involved, definitely come to us, and
Absolutely.
we will find somewhere. And then, you know, sometimes it may just be a mailing that we have to do in the office, and if someone wants to come in and help with that, then there's little things that they can do at the office as well.
Right, we can find something for them for sure. So if the viewers are watching today, we've given a lot of information. What's one thing you want them to take away from today's show?
I hope that all the viewers know that KCP does exist. And so we are a unique organization, like you said. We're a local organization. Our office is here in Paducah. We cover the Purchase area. And we want people to know that we are here to serve them as navigators. Let us help you navigate the system, navigate to resources and things that you need, and don't hesitate to call us. And so if you need a phone number, it's 270-442-1310. And I know Tracy would just be happy
I'll answer.
to help anybody that needs anything.
Right. Well, Jamie, thank you for being here today. We really appreciate it. I think you've shown a new light on KCP and let everybody know what exactly we do, because, you know, a lot of people didn't know that we were out there and had those resources. Thank you for joining us today. For more information regarding the Kentucky Cancer Program, contact our local office at 270-442-1310. Our mission at the Kentucky Cancer Program is to reduce the burden of cancer in Kentucky through education, research, and service. Contact us today to find out ways we can serve you or volunteer opportunities for you to help in our mission. Have a great day.